Welcome, everyone, and thank you for joining us for the seventh and final installment of the Prevalence Reduction Innovation Forum Learning Series. Today's session will feature a presentation on the PRIF study on domestic servitude among Tanzanian women who have returned from working overseas. After the presentation, as usual, we will have a Q&A session, and please use the Q&A function rather than the chat feature to ask your questions, and our presenters will answer them live after their presentation. Thank you again for joining us, and I'd like to say that it has been an honor serving as the coordinator of the PRIF and working with the study teams over the past few years. And I will now turn it over to the CenHTRO and PRIF director, Dr. David Okech.
Thank you so much, Dr. Letraris. And I always tell Lydia, don't call me Dr. Okech because I really don't recognize that, but David is okay. Good morning, good afternoon. I'm sure it's afternoon in Tanzania right now. And what a pleasure, actually, for all of us. We are so excited, not because this is the last presentation, but we're excited because this has been such a successful project, actually, by all standards and by all means. So last but not least, we have researchers from New York University, University of Alaska Anchorage, and Community Health and Social Welfare Africa, who will present their findings and lessons learned about estimation strategies used to measure the prevalence of forced labor among domestic workers who worked abroad and returned to the Republic of Tanzania. The research evaluated two sampling strategies: one, multi-stage probability proportional to size, or PPS, and two, Vincent Link Tracing Sampling, or VLTS. The study focused on returned domestic workers in Jerusalem and Zanzibar. Actually, very interesting. I was in both cities just last month. Both methodologies found that over half of Tanzanian women were victims of domestic servitude while working abroad. Welcome, welcome, welcome. Again, as we said last but not least, welcome Meredith and team.
Thank you so much, David and Lydia. We are honored and privileged to be wrapping up the PRIF Learning Series. We've got lots to share, including you'll get to hear a little preview of some of the amazing intervention activities that ComHESPA, along with Amana, have been working on over the last year or two. So first things first, and we're going to dive a little into the findings of the prevalence study, so we can learn about the issue of forced labor among domestic workers who go abroad from Tanzania. So I will also say there'll be a special guest. Dr. Sheldon Jang will also be joining and sharing some findings as well. And Kyle Vincent, who's on the call. We are all here to answer any questions in the Q&A afterwards. So go ahead with the next slide. And excuse the slow transition. So a little bit about background and context. So Tanzania is described as a source, transit, and destination country, as reported not only in the 2022 report, but I think in the last several TIP reports. As of the 2024 TIP report, Tanzania did not fully meet the minimum standards for eliminating trafficking. However, we're hoping that the project that we're doing helps them get a little closer to that. Tanzania is a hotspot for migration and transnational trafficking for domestic servitude. A lot of, as we'll talk about during this presentation, a lot of women in particular who go overseas to work as domestic workers have few opportunities back at home to make money and support themselves and their family. So oftentimes migrating abroad is their only option. And similar to the other PRIF studies, there have been no prevalence of domestic servitude in this population, particularly in Tanzania. So this is filling a huge gap with regards to that. Next slide. So our study population was limited to adult domestic workers. We did not focus on those underage and only focus on those who've gone abroad to work as domestic workers, not within the country of Tanzania. So we focused on those who had returned within the last 2 years, and our study sites were Zanzibar, and there are 2 districts there, Mijini and Mijini Magharibi. I've been practicing that. Hopefully I didn't mess that up too much. And Dar es Salaam, specifically Temeke district in Tanzania. In Dar es Salaam, I should say. So a little bit about the procedures. I should say specifically Furaha and the ComHESWA team, along with Amana, had been working when we first applied for this with the Anti-Trafficking Unit, the Ministry of Health, TIESA, which you'll hear a lot about, which focuses on training individuals before they migrate abroad to work, and the Zanzibar Department of Labor. We had to go through the Tanzania Country IRB, which included the Commission for Science and Technology and the Zanzibar Research Committee, which is no small feat. So thanks to Furaha and Amana and team for shepherding that process. There was a recruitment and training of research assistants process at the beginning. And we'll dive a little into more of that and what that entailed, specifically what we thought we were going to be able to do versus what we ended up doing with regards to mapping and getting data. So there was community awareness for local government authorities. You have to get local government buy-in to be able to do any kind of research. Particularly, there's local leaderships, which Amana and Furaha can talk a little bit more about. But, with them, they then let others know that there'll be researchers coming into the community, asking questions, and this helps increase safety for not only the researchers, but the community for participation as well. One of the methodologies, which we'll talk about, involved conducting household surveys. And then there was the second methodology was generating seeds for link tracing. As you can see, we timed it really well for COVID, and this is a little time capsule for everybody. Almost all of us were wearing masks when we first went there and part of the training. When you look back at it now, it seems like many, many moons ago, but it was only obviously a handful of years ago. And again, we were, despite COVID and all the restrictions in place, managed to, I think, do a really good job with the prevalence study that we will be discussing today. So here's just a little bit of the pictures earlier were some of the folks we had met with and who were part of the research group. This is ComHESWA and team spreading awareness in specifically the Temeke district in Dar es Salaam. We like pictures. It helps give context, and it's more interesting to look at. And then there was awareness specifically in Zanzibar for the Shahias in Mjini Magharibi in Zanzibar. So you can see a little bit about the process and what it entailed. So as far as the household mapping, initially we were hoping to rely on the Tanzanian government to share administrative data as far as who they had in their books, who had gone abroad to work as domestic workers, so that we could then map the individuals for the household survey. Unfortunately, what we learned is that those administrative files were not as detailed or comprehensive as we wanted them to be. So then ComHESWA stepped up to the challenge and ended up having to map where the domestic workers were living, both in all three districts, so in Dar es Salaam and in Zanzibar. It was no small feat. It required a lot of knocking on doors, asking if anybody in that household had migrated abroad for domestic work. And, despite all the hard work and resources that it took, now there is a nice comprehensive map of where domestic workers who had gone abroad to work as domestic workers that can then be shared back with the government. You can see all of the folks we met, as part of this process and the mapping process. Next slide. So here's a little bit more about conducting the survey itself. So originally we were going to do a PPS design, which is a traditional household survey design, but because of the lack of administrative data, we had to pivot, and Kyle ended up, we decided with Kyle, as far as the sampling goes, to use a stratified simple random sampling design, which started with the mapping exercise, so we can get an idea of what the sampling frame should be. Enumerators then returned to the household identified in the mapping exercise to apply the survey. So again, several knocking on doors, asking if the person, anybody there had migrated abroad in the last 2 years for domestic work. And then if the answer was yes, they did not conduct the survey at that time. It required them to then afterwards, Kyle sampled those who did say yes, and they knocked on the door to then administer the survey at that point. So it was a massive undertaking and, incredibly expensive in the end. Next slide. The other methodology used was the Vincent Link Tracing Sampling methodology, obviously named after Dr. Kyle Vincent. And that is basically taking respondent-driven sampling and amplifying it and speeding it up a little bit. And this idea is that it gets more at the hidden populations because folks end up recruiting other individuals that they know who've migrated abroad. So it's not necessarily knocking on doors, but asking their friends and other people in their social network into the study if they qualified. However, as you can see, and it does require more seeds than a traditional respondent-driven sampling. So a large number of seeds were identified, 345. However, as you can see by the sample network graph, there were a lot of isolated seeds. So that means all those green dots that don't have a branch connected to them means that those folks either did not know other domestic workers who had gone abroad to work, or what also happened is that because we were focused on those 3 districts, we could only recruit people who lived in those 3 districts. And domestic workers are very transitory, so they bounce around a lot. So particularly for those who had come in from more rural areas of Tanzania and either used Zanzibar or Dar es Salaam as a pit stop, a lot of them had migrated back to their communities and their villages at home. Meanwhile, others just moved around a lot or had already gone abroad to work again as a domestic worker. So this didn't work as well as we hoped. I think we learned some really valuable lessons around domestic worker populations and how maybe isolated they are and where a more traditional household survey might work best. So what we did learn when we estimated the population is that with the SCSRS, it was 2,180, but an efficient estimate of population size could not be attained. So we ended up using that. That was the number. And if folks have questions about that, during the Q&A, just based on time right now, we won't go into details, but I'm sure Kyle will be happy to share how that number was generated. Whereas the link tracing methodology, because of the isolated seeds and limited networks, we have a massive range for the population estimate of 2,000 to 16,000. So, when asked about how to proceed, we've been erring on the side of caution and estimating it to be around the 2,000 to 2,500 mark. But this just goes to show how difficult it is, particularly with certain populations, to measure the size and the prevalence. I think similar to those who've joined some of the other PRIF Learning Series presentations, this was a similar way that, thresholds that were measured as to whether or not somebody was, quote, identified as a potential trafficking victim. And this was based on the PRIF indicators set by JTIP. So threshold 1, which was more of the severe forms of trafficking, which having to perform sex acts to pay off debt or receive wages, and losing freedom of movement due to surveillance, isolation within the workplace, or losing freedom to communicate with friends or family, which sadly, as folks who know about many of the situations of domestic workers, this is all too commonplace to have your phone taken away and being limited in being able to contact friends and family, particularly back home. Whereas threshold 10 was made up of 10 categories, including a wide range of abuses during recruitment, employment practices, degrading work conditions, debt bondage, and violence. So in order to be, again, considered a victim of trafficking in this context, they would have had experienced 2 or more of the abuses in threshold 2, but only 1 in threshold 1. So final sample for the SCSRS was 1,052 unique individuals of how many people were surveyed. And as you can see, there was an incredibly high overall rate of domestic servitude at 69.1%. And that combined thresholds 1 and 2. If I recall, that is probably the highest number of all the PRIF studies of folks who have experienced forced labor and domestic servitude in particular. And when you look specifically at threshold 1, which is again, that lack of freedom of communication and movement, in addition to having to engage in sex acts to pay a debt, etc., 38.1% is incredibly high. And then 65.5% of that sample met threshold 2. So we're talking about a very vulnerable population and a very high percentage of people who've experienced a number of different violations and trafficking. For link tracing, it's somewhat similar, slightly lower, but not too much of a difference in what we found there. The final sample size was 788, and around 60% of the overall rate of domestic servitude, and 27.5% of the sample met threshold 1, and 56.5% of the sample met threshold 2. So looking at the demographic profiles for both methodologies, over 70% of the domestic workers in Tanzania were between the ages of 26 and 40. 32 to 36% were currently married in a monogamous relationship, and about 28% had never been married. A very large percentage, 85 to 86%, had at least one child, and over a third of the sample reported having 3 or more. And over 90% of the respondents in both samples reported that their highest level education was either primary school or ordinary level, which means that they did not get past high school for many people. So as far as the employment characteristics go, it is very common that Tanzanian domestic workers migrate to Oman, given the historical relationship that Oman has, particularly with Zanzibar. Again, Q&A, folks are particularly interested in learning about that, but somewhat similar cultural practices, and many people in Oman speak Swahili. So it is very common for the individuals to go there for domestic work. Followed by, in this case, United Arab Emirates. What we're learning in our intervention, which we'll talk about, is that there have been MOUs set with Saudi Arabia and with Qatar. So we are seeing an increasing number of women going to those countries as well, but Oman still is number 1. About 14 to 18.5% of respondents reported that they attended a pre-departure training by TAISA, which again, we'll talk about with the intervention, but this is where essentially they would learn about what their rights are, what to do if they were in trouble, particularly about learning about the culture and how to be a domestic worker. And so very small percentage of individuals attended a pre-departure training, and when asked, very few even knew what TAISA was. And then, one thing that is supposed to happen when they go abroad is that their employer is supposed to take them to the Tanzanian embassy once they arrive in country. And, a little less than half the percent of the participants didn't know that that was a requirement. And so obviously did not do that. And that's a way that they can be registered with the Tanzanian embassy, et cetera. Between 51% and 43% of respondents reported being forbidden to leave the workplace, which is sadly not uncommon with domestic work, but is obviously still a major trafficking abuse. And then 14%, 8.5% to 14% of the workers reported having experienced physical violence. 11 to 15% reported having experienced sexual violence, which is a pretty large percentage. A little bit of the conversations that we had with some of the women there was, again, not uncommon for their bedrooms not even to have a lock on them in the house, which means that at any point, anybody could walk in. As far as whether or not any of these individuals sought help, of those who reported experience any workplace abuses in the survey, a bit more than 0.5% reported seeking help. Particularly from the Tanzanian embassy, which is a good sign for anybody who's done work on domestic work. Oftentimes, the embassy is not the first place. It is the employment agency or broker, which also was a common place for them to go to. And these are why we've decided to focus on this for one of our intervention activities. The most common services received were mental health support or help being repatriated back to Tanzania. However, when asked about the reasons for staying in the job despite experiencing these abuses, common responses were loss of wages and withholding of identity cards, particular passports, which again, we are learning is a common practice and normalized within communities that go abroad for work. It is almost expected that their employer will take their passport with it, and they don't even know it's their right to be able to hold on to their own passport. About 20% reported that they were not ultimately helped in the ways that they wanted to be helped. And now we will pass it over to Sheldon to talk about the methodologies.
Thank you, Meredith. Yes, as Meredith previously presented, this is a very challenging population. The two critical challenges that we encountered is that one, these are highly mobile population and they move around quite a bit. And the second is that their existence within the larger population are quite sporadic and also somewhat isolated. So if one wants to study a population such as this one, our overall tendency is leaning towards the Vincent Link Tracing approach, unless you have a decent sampling to go forward. Now, without a decent sampling frame, like such as what we had in our situation, so we had to spend tremendous amount of time and resources sending teams around Temeke and Njini in Zanzibar to literally scouting the entire community where we're about to do data collection, to literally map out the clusters where these migrant domestic workers resided. So that actually is quite an enormous undertaking. So although the actual operation, of course, anytime if you have a simple random sample or probability-based sampling, there are well-established field procedures. So you can just literally follow it, provided you have a decent sampling frame. So for us, that was a tremendous undertaking to generate a sampling frame and then to essentially stratify the city or the geographical regions where those clusters are. And then you go through that and apply the simple random sample, then you go through it. So the actual operation in terms of data collection is much simpler for simple random sample for those of you who are in the sampling business. But the generation of the sampling frame was a tremendous undertaking for us. Now, link tracing is an effective approach. For those of you who are familiar with RDS sampling strategy, and that's in terms of operation, link tracing are the VILTs in our case and RDS are very similar in terms of recruitment, with the two critical differences here. And this is where, again, I sound like I'm a salesman for the VILTs approach. That is, we started with a much bigger initial sample, the seeds so-called, as opposed to purposive a small number of seeds, like at a conventional RDS, where you start with 4 or 5 or 5 or 6 seeds, purposively recruited in the community and go narrow and deep into the community, hoping your sampling will reach the edges, the parameters of your hidden population. Our strategy relied on a large number of entry points or large number of seeds that are widely scattered across the community, and then we'll follow all these seeds and trying to see how far they will go. But we also limited the number of waves we generate, typically 2 to 3 waves, and then we will stop. So our approach in this case is wide and shallow, as opposed to narrow and deep. And we believe this is a much more efficient way in estimating the hidden population. So that in terms of link tracing, we have the challenging for link tracing compared to simple random sampling is that there's also a tremendous amount of matching and record keeping and so on and so forth. So operationally, it's a little more complicated than simple random sampling. So I'll stop there. Meredith, you want to take over?
Oh, sure. As far as limitations go, as you heard, there were several, but data collection was limited to 3 districts. So it limits the generalizability as far as what we can say. However, we can say with confidence that the majority, if not almost all women who come to migrate abroad do need to pass through Dar es Salaam or Zanzibar. So we are relatively confident that those were the right places to focus on to get the most amount of individuals who had migrated abroad before. We were not able to implement the full-fledged ENSOM design, which we did not discuss, but all of the PRIF teams were supposed to be implementing ENSOM for a meta-analysis. However, given the intensity of the 2 methodologies we did use, we weren't able to do the full ENSOM questionnaire. And then, as I had mentioned before, the transitory nature of this population made it incredibly hard to do linkages and to do referrals. So despite us thinking that might be the better option, the ideal world would be their administrative data and to use a household survey approach, because the link tracing is just really complicated when people are moving around a lot. Next slide. And now I can pass it over to Amana and Furaha, so you can learn about the intervention itself, which we're super excited about.
All right, thank you, Meredith and Sheldon. All right, yeah, thank you for sharing the research background where this all started from. But the question now is, we know we've researched, we've all the knowledge about what's happening, but what are we really going to do for these women to support them? And so this is where the project intervention comes in. And so I would highlight that the Wezesha Kazi Salama project is actually a name that the domestic workers themselves selected for this intervention part. And for that loosely translates to build capacity for safe work. And so their intervention is really about then how do we reduce domestic servitude by building capacity. And this work has been done a lot by Furaha and the team. And so we'll transition to Furaha.
Thank you. Thank you so much, Amana, for that introduction concerning the intervention part. Actually, after this research report, we went back to the government. We disseminated the report to different departments of the government. And the government, through the Prime Minister's office, and actually through TAESA, they decided to convene a meeting with different stakeholders to discuss the report, but also to come up with designing interventions, suggested interventions. So we came up with 4 key interventions, and one was the creating community awareness, because as you heard from the research, many domestic workers, they are not aware even existence of the Tanzania Employment Unit, which facilitate formal and safe migration of domestic workers to go working abroad. So we agreed to develop the basic pre-departure training that can take like 2 days. The existing pre-departure training was like for 2 or 3 hours. More or less was more of orientation. So we agreed to have 2 days training, the pre-departure one, which will highlight the issues of knowing their rights, but also how to protect themselves against gender violence. As we have seen in the report, it's very high among them, but also to know the importance of reporting to the embassy before they start to work when they go to work in the abroad. And the second interventions concerning community awareness. Next slide, please. Can you get next slide?
Yeah, that one.
Yes. So also
Okay.
we decided to develop information, education, and communication materials. We had the brochures, we had flyers, which that was accompanying the community theater. The community theater that was developed purposely for raising awareness among the community members, just to know the importance of following procedure. Formal procedure when they want to go to work in abroad as a way of reducing risk on the issues of human trafficking. So we have the posters, we have the billboards that we made that were hanged in the community. Actually, this is in English, but we translated to the local language, to Swahili language, so that they know that if you, yes, we agree that they're saying it's an opportunity to go abroad, but they need to follow the procedures. So there was contact there. If they want to go to abroad, what are they supposed really to go through? Because in the research actually showed that if someone goes informally, the chance of getting gender-based violence actually is very minimal. So we have different materials, the brochures, we had posters, and we have billboards. But also we had developed a community theater. This is a very participatory community theater where it has two scenarios, one showing some women who went through formal channel and those who went informal channels, the consequences of following formal procedure and informal procedure. It shows the consequences of that, and that actually raised a lot of awareness to the community members. We perform this community theater in the community level, but also we go to the schools. And why we go to the schools, as you have seen in the research report, most of the people who are engaged in these domestic workers are just finished Form 4 or Standard 7. I'm trying to play this one. I don't know if I can play this. You could see. Actually, in Dar es Salaam, in one school, we reach out more than 2,000 plus students. And this means that these students meet with their parents, which are almost the same number. Normally, in our secondary schools or in primary schools, one family can have 2 or 1 child. So if you reach out 2,000 students, that means you are reaching automatically 1,000 plus parents, because normally they go back and share to their parents. And these were shown actually when most of the parents were coming to our office asking a lot of information about departing, going abroad, and other issues. Yeah. Next slide, please. Next again. Yes, this is the highlight of the 2-day intensive training, which is it's about overview of labor exploitation and trafficking. But also during the what is really interesting in the pre-departure training. In pre-departure training, also we invite the experienced domestic workers who went abroad for like 2 times. They share their experience. The list of those women who have stand up in front of others are the ones who went abroad, returning from abroad, who worked domestic workers for more than 2 years or 4 years. So they are trying to share with them that what to do and what you should not do. How can you do in order to protect yourself, just in case you find any danger? And what are you supposed to do when you find those indicators of danger? So it's very informing and very impacting. Yeah. Next slide, please.
identifying recruitment agencies.
Yes, another intervention is to identify and train recruitment agencies. What we found actually, recruitment agencies, they have a bigger contribution on making safe migration for these women. So we identified in collaboration with the government, we identified them and trained them on their role on how to protect these women from gender-based violence, but also to protect them from trafficking in person issues. We also raised awareness on the existing laws and the policies that guide the whole process of safe migration, but also promote them to work with informal recruiting agencies, because we noted that there is several peer recruiters, but also those who are not employed by the government. So we promote them to really work with them in order these women to migrate safely from their countries to domestic work. Next, please.
Okay.
Over to Amana for the next slide, sir.
Yeah, so another part of this project involves providing vocational training to women who have expressed interest to migrate, to work abroad. And therefore this kind of really tries to test whether vocational training skills would actually help to prevent sort of that departure or not. So we have partnered with the National Vocational Education Training Authority to provide vocational trainings programs for these women. And these are programs that the women themselves have selected. And so we take them through these trainings on average about 3 months. And so far, the main vocations being selected are baking and cooking, decoration, driving, as well as tailoring. Up to this month, we have about 19 women who have participated in different vocational training programs like driving, tailoring. There's about 6 doing tailoring, 6 doing saloon, 3 who are now doing cooking. The one thing I'd like to say is that the vocational training programs are highly popular. They are highly sought after. They're highly in demand by these women. And so, but we have a limit as to how many we can enroll. We're not enrolling all the women, obviously. The selected, randomly selected in our cohort-based model. At the end of the project, we aim to have at least 84 enrolled in the vocational programs. I'll skip those videos. Part of this is also follow-up and tracking. Those who have left the country, we have designed a very robust tracking system, post-vocational training as well as pre-departure training. And this is happening through their social media and contact. I think this happens within the 2 weeks of their departure. And the women have created a WhatsApp group that is primarily where this follow-up is happening. We can talk more about this, but it's been a very positive experience to work with this. So overall takeaways, what we have seen is involve the domestic workers. The domestic workers have played a big role in terms of the kind of topics that they want. It comes in terms of selecting the kind of vocations that they want, but also providing sort of input on the content. Form partnerships. This is really about partnerships. It's ComHESWA, NYU, UMass, UAA and other government stakeholders who are really involved, including recruitment agencies and banks. We've included a CRDB, which is a local bank that is offering financial training for these women. But there's also a lot of learning and unlearning. There's things that we initially designed, and through the input of domestic workers, these have been revised or basically changed. And so, for instance, we have learned that the content of the pre-departure trainings perhaps was not fitting the level of education, and in partnership with the women, we have been able to revise some of the content, perhaps, right? So that aspect of being open to learning as well as unlearning what we initially assumed. And of course, there's work, but there's also a lot of singing in this project. These videos are basically showing that. I don't know if you can hear this. No, okay. And Asante.
Karibu.
So we have about 15 minutes for Q&A.
Thank you so much, Meredith and Sheldon and Furaha and Amana, for the great presentation. We have one question here about the vocational training. How were the vocational training areas chosen, and is there a high demand for these in Tanzania?
Yeah, so I can say, and then of course others can chime in. The vocational training programs are, as I said, were selected by the participants themselves. But first of all, we reached out to VETA, which is the Vocational Training Authority, and they gave us a list of the programs that they have. And then, of course, COMESA reached out to these women, and the women selected which programs that they were most meaningful to them, or the ones that they wanted. So we did not basically select these for them. Yes, they are in very high demand, and because obviously it offers a way out of towards employment. So a lot of these women, as we described in the research, are already coming from marginalized backgrounds, low income. If you know about Temeke district and some of the areas in Zanzibar, these are already low income communities, and so for them, a vocational training offers a way, in a way, out of those challenges. And so, yeah, it's highly demanded, but also there's been an overall shift by the government towards more vocational training. And so this kind of aligns with the priorities of the government to create more vocational skills. So, yeah, so it's about how do you balance between who gets and who doesn't get. In fact, we've been running into those challenges about people who don't get selected to the programs. They get a little bit disappointed, right? They're like, they don't really understand why they're not getting in. So yeah, the demand is high, and so we're trying to. But obviously the project has limits as to how many people we can enroll. So.
I also want to share, I want to make sure that I highlight the work that COMHESWA and Amana have done in getting the government to buy-in all of this. We wouldn't be able to do it, unfortunately, without it. A lot of these, for example, the TIASA and the Department of Employment in Zanzibar are the ones, in order to make this sustainable, that need to carry on this work once this project officially ends, to continue to train the women. So they have come to the table. It's not like we're paying them to come to the table, but I think the findings from the study were a wake-up call a little bit about what was happening to the citizens abroad. And so they've done they're a huge part in coming to the table to work with COMHESWA in administering the trainings In addition, they particularly have taken it upon themselves to look into opportunities to work with the local college in both locations to provide training at their own cost of the women on how to operate appliances, how to work as a domestic worker, et cetera, because they also acknowledge that by women going with that skill abroad, again, less likely to experience abuse and other types of things in their work. So I think there has been a lot of partnership, as Amana has said, which is really crucial to not only the success, but the sustainability of all of this work. And again, I want to highlight the tracking that we're doing, particularly after the pre-departure. This has been tried in other projects to varying results and success, but we're really hoping to get a better understanding of what these women's conditions are once they do go abroad and how the training may or may not have helped them in helping negotiate with their employer, but also seeking help in the more formal way as opposed to running away. What if they are not able to negotiate or mediate with their employer. So we're excited to see what those results are like in the hopes that these are all promising practices that could essentially be scaled up and brought to other countries as well.
Thanks,
There's a
Meredith.
question here, but mine is just quick, just to follow up. I think there's a question on methodology here about PPS, but just to follow up on this thing quickly. Are there girls or women who are deciding not to go abroad after interacting with you? They're deciding that I'll be better maybe staying here and perhaps finding some way in Tanzania instead of still going abroad?
I don't think we've encountered that so much. I mean, that's, I think, part of the demand for the vocational training is that they can stay behind and get training and some startup kit afterwards to start their own business. But I don't think we're hearing that women are just abandoning it altogether. I think the only option, right, is to make money. And if going abroad is that, we're just hoping to make it safer. So I don't think there's much, but as Amana pointed out, the vocational training is in incredibly high demand because most of the women do not want to go abroad to work. They'd prefer to stay with their family and particularly their children. And I'm going to let Sheldon answer Andy's question.
I'm wondering, Meredith, if I can just throw out, we are currently running a very small, tiny RCT. Trying to work out if there's a chance to roll out a bigger RCT. I want to find out whether with a vocational training, would that slow down or convince these women to stay in Tanzania and work as opposed to going abroad. You know, the assumption, of course, from our anecdotal stories, and these women, yes, would rather not go elsewhere and work inside Tanzania. So we're trying to figure out how if it's possible to run a real RCT to compare. Okay, Andy, yes, the great question. We for conventional PPS, again, it all boils down on the sampling frame, availability of sampling frame. Now, for regular PPS, as you essentially you packed your sampling strategies against the population size. The bigger the population, the more you get the sampling share. So initially, we were planning on just doing 8 TPS. Then we quickly realized these the clusters of the domestic workers are highly skewed and distributed differently in different pockets of the geographical areas. So if you were to follow just the conventional PPS, you would be missing a lot of these pockets. So that's why we did an extensive mapping exercise and identify these pockets. And once you have those pockets, then there's no point of doing PPS. You just stratify. Once you stratify it, we find out those pockets. Then we just simple random sampling, just sampling among those pockets. That's what we did. In terms of why the VILTS strategy yielded less, it's actually not that less. There's about 9 points of spread, but the overlap, the significance, one is about 60 1%, the other is 69 point something. So there's a 9-point percentage. So I would say they're still highly comparable. So with these two strategies, the overlaps is significant. So there's, yes, the certified simple random sampling generated a few more percentage points, but I wouldn't make too much out of that difference because these two are highly comparable. Thank you.
Thank you, Sheldon. And we have a couple of questions in the Q&A function. One was, how were the seeds for the VLTS identified?
That was through the mapping. So they identified some seeds as they were mapping those districts as well and set aside those households to act as seeds. So that was one way in which they did that. And Furaha, remind everyone, was there additional ways that you identified seeds? Did you go through any additional local NGOs, et cetera?
Yes, yeah, we had to do so because it was like there was cutting off of the continuation of those seeds because of the mobile nature of those people, and we are not supposed actually to go outside the specific districts. So sometimes you get someone is mentioning someone who is out of that district or out of that region. So we had to cut off. We had to identify new seeds. So we had to add up a new seeds. Yeah.
My memory blanked out. How long did it take us to complete the link tracing sampling? I want to say roughly it's about 4 to 6 weeks. Furaha, do you remember the link tracing component?
Exactly. Yeah.
Okay. Yeah, I remember correctly. So yeah, about 4 to 6 weeks. But in terms of what aspects with the link tracing method shown to be ineffective, I don't think it's as ineffective so much as the limitations of the inherent limitations inherent in the population we're trying to reach. Because of the high mobility and also because the parameter we set, the geographical parameter we set, a lot of seeds did not generate, in other words, a lot of dead seeds, so did not create networks. And also many of these networks do not overlap, which is the other aspect we're looking at, whether networks overlap with one another. That's why the range was so tremendous, anywhere from 2,000 to 16,000. That was our estimated population size for this population. So that's the sort of a drawback because we limited to the city parameters. If you were networked with someone outside the parameters, we would not go outside to interview them. And also, this is highly transient. Their friends, people who they know, were also working as a domestic migrant, may already be gone overseas or in other cities. So that created a lot of dead seeds. That creates a lot of, that's why we went up with a large confidence interval. But thank you for the question.
Thank you, Sheldon. I think we have time for one more question. Can you speak more about the recruitment channels for migrant domestic work for these women and anything additional you've learned about how they're recruited as they've continued to work with the team in the vocational training programs? Thank you.
Furaha, can you speak a little? I think a lot of the women seek the opportunity out. They're not approached about the opportunity. So Furaha, can you talk a little bit about whether or not they go to the broker? Do they go straight to an employment agency?
Yes. Actually, we have more than 18 recruitment agencies in Tanzania. So these trainees go through those recruiting agents. Recruiting agents communicate with employment service unit of the government. And we as COMUHESWA, as partners who have designed the training, we work together. So we communicate with the government, they tell us how many have they mobilized so far. then we prepare the training, we do it. So the recruitment is through those recruitment agents, and that is a procedure actually by the government that have proposed. Everyone should go through recruitment agents. Yeah.
So I would say, I mean, Sheldon and I have done some work on domestic work in Ethiopia where there's a lot more informal brokers working. I think in Tanzania, what we see is the opposite, is that there are a lot more formal recruitment agencies working with the government. You know, to the degree they were held accountable to follow all the procedures, et cetera, is one conversation that can be had another day. But I think the idea is that it is a lot more formalized within Tanzania. So in theory, by strengthening the formalizing process and getting word out about why going through the formal process is highly beneficial. You know, we heard from a woman when we were there last time that went through the formal process that said that she had the best experience working abroad. She got taken to the Tanzania embassy, you know, all of the things that were supposed to happen. She got all of her money and was able to come home and, you know, build a home, et cetera. So that's what we're hoping to do, is to highlight why going through the formal process, but I think it is on the more formalized side, as opposed to informal brokers going to small rural communities and trying to recruit people that way.
And in fact, there are a few who find themselves in the trap of informal recruitment, and that is just because they don't know if there is formal recruitment. That's why we have this awareness program in the communities, and also we use medias to say that there are formal organizations who are doing this recruitment. If really you want to go abroad, please go to these organizations. Yeah.
Thank you. And actually, we do have one more minute. So maybe one more question. Did you do a formal analysis of the cost and time of these two methods?
We did. So I don't remember the numbers off the top of my head. So if you're interested, feel free to reach out. But we did do that exercise. And because of the mapping that was required, the STRS, I'm getting it wrong, but was way more expensive than the link tracing, just because of the time and resources and manpower it took to do that intensive mapping exercise. So, you know, again, in an ideal conditions, probably the household survey would have come in less expensive, because you don't have the whole incentive structure of having to recruit people and get paid for it, et cetera. But because of the mapping exercise, that methodology was way more expensive. And that's it. We wanted to thank you again for everyone for joining, asking some great questions. You can reach out to us at any point. We will be wrapping up all of the interventions and the different research projects that we're doing as part of those intervention activities in 2026. So we'll be excited to share the results with you then, but we appreciate your time and attention.
Thank you so much. Thank you so much, Meredith and Sheldon. I'm sure we didn't mention at the beginning, and we didn't know you're going to be one of the presenters. So we also acknowledge you, Sheldon. Thank you so much. This was like the best, maybe preserved for last, right? Excellent presentation. I really appreciate that. And we are looking forward now. This brings us to the end of our learning series. We've had all the 7 teams present. It's been a wonderful marathon since, I think, November. And so this basically is one of the final activities in PRIF. Now we are just about to submit our special issue, which will come out of this study. We want to thank everybody who's been engaged in this project. I want to thank with my very own team, Lydia Letraris, who's been the great coordinator of PRIF since day one. I remember our first PRIF meeting was May 2020, and now it is 2024. We are ending PRIF. It's been a long journey and a long process. I want to thank Lydia. Also for this series, I want to thank Andre Galand, who is our communication director here. Thank you so much, Andre, for planning this, organizing this. I know people's schedules and everything is always a challenge, but we have made it. Last but not least, also, I want to thank the Department of State, for funding this project. I see some of them are here, Natasha and I think Willow and Casey, maybe I think were here. But I really want to thank them for this opportunity to be able to do this. The goal of this was to focus on hotspots, to try to do something different from what we have in terms of national aggregate, prevalence estimates. So we're looking forward, and hopefully this project is going to add something to the science of prevalence estimation. Thank you so much. We've made good friends, and it's been wonderful. Tanzania, asanteni sana, tunashukuru. Mungu awabariki. Bye-bye. Thank you.
Asante sana.
Asante, thank you.
Thank
Asante.
you.